Most of us have heard of the struggles of addiction, either through media, literature, or personal experience. Either a family member or ourselves have experienced addiction firsthand. According to the American Society of Addiction Medicine, addiction is a continuous use of a mood altering substance or behavior, despite the consequences. There are different types of addiction. Basically, an addict can be addicted to people, places, or things. Examples of these people, places, or things are alcohol, drugs, gambling, shopping, food, relationships, and more. Today, we will discuss the causes of addiction, the effects of addiction, and recovery from active addiction. Causes of addiction. There are many possible factors: psychological, biological, and social. These things can increase a person's risk of becoming an addict. According to the CDC, 64% of Americans drink alcohol, 50% are regular drinkers. Every year, 22,073 alcohol deaths are unrelated to accidents, suicides, and homicides. These deaths are only caused by liver disease due to the complications of alcohol. Other causes are lack of a healthy, nurturing home environment. If a child didn't have the acceptance or importance in their home, this could cause them later on in life to have addictive behaviors and possibly use substances, like money or drugs or gambling, anything of that nature. Gambling, especially teens and young adults, according to Family First Aid, says that there was an increase in gambling of 600% in this age group from the year 2001 to the year 2005. 600% increase. The effects of active addiction can be diabolical. Changes in the structure and function of the brain from drug abuse make it impossible to safely stop using without a professional intervention, either by the addict themselves being so desperate that they know that something has to change in their life, or by their family and friends getting together with a professional and confronting them and giving them an ultimatum of whether or not they're going to go to a treatment facility or the family has to give up. Physical effects of drug addiction, as reported by the National Institute of Drug Abuse, NIDA, depends on the consumption and what kind of drug or substance they're using. Symptoms are heart rhythm irregularities, heart attacks, breathing difficulties, respiratory effects, nausea, vomiting, abdominal pain, poor muscular skeletal development, cramping, muscle weakness, kidney and liver damage, seizures, memory loss, and cancer. The physical effects are just terrible. They go on and on. And it's sad because an addict will continue to use, despite these consequences. And it's just a very sad process to have to see. Psychological effects include depression, anxiety, stress, even someone hallucinating due to the extreme use of certain drugs. Methamphetamines and hallucinogenics also cause someone to hallucinate. It could cause a lot of stress in someone's life. Also, paranoia and anger and aggression are other psychological symptoms, especially if you haven't seen them before in a person and all of a sudden they're acting this way. This could be a clear sign that these are effects of active addiction. Researchers suggest that about 4%, that's about 1 out of 4 college girls, are bulimic. About 50% of people who have had anorexia will develop bulimia or bulimic patterns. Eating disorders are mostly found in young women. About 10% are males. I know that even when I was in high school, there were a lot of signs and cases with kids my age who were suffering from these types of things. Another effect is social effects are often noticed by family and friends of some addicts. If you are recognizing these changes, like I was saying before, in aggression, them being selfish and lying, lack of interest in their usual things, if they normally play sports or they normally just shop once in a while and you've seen an increase in these behaviors, this is a sure sign that they're possibly using extensively and that they may need help. Also, another effect is financial issues. This can also, cause someone to lose their job, lose their house, not be able to pay their mortgage. There have been results too that if somebody who normally is responsible starts committing crimes, this individual may be going through addiction. Their behavior just changes and they go to any means and ways to get more. It's a very serious matter, the effects of addiction. The beautiful thing about addiction is that there is freedom on the other side. Recovery equals freedom. There are multiple options for addicts to receive the help that they need. Unless an addict really wants the help and they're so desperately, craving the change in their life, they have a much better success rate. If the addict, is doing it for other reasons, their chance of relapse might be greater. Some of the options that addicts have for treatment include inpatient dual diagnosis centers. These places help with more than one addiction. So if you're struggling with, say, an eating disorder and gambling, a facility like this will give you the means that you need to get better in both of these addictions, not just focusing on just a substance abuse. Also, they make these environments very comfortable for addicts, and usually these programs are 30 days or plus, depending on the individual and how much help that they need. You'd stay up to 90 to 100 days in one of these facilities. There are also outpatient programs, which is another option. This is when an addict still resides at home or where they were living, but visits a treatment facility 2 to 3 times a week. And this program usually also is either a 30-day program or, depending on what the individual needs, a longer program. There also are maintenance programs for addicts. These include medications like methadone and Suboxone. There are methadone, Suboxone centers located in most states in the United States. These are medications that addicts go on that are a daily maintenance, where they take the medication once or twice a day, depending on the individual, and these addicts could lead a pretty normal life. But according to the National Drug Intelligence Center, Suboxone is being abused by patients. There was a lot of research done, and because methadone is mostly taken at a clinic where people are supervised, and Suboxone is taken at home, so you can have more of a free life, you can go on vacation and lead a more normal life. So doctors have found out that patients can abuse Suboxone and have. The last option that an addict has are 12-step programs. These have been very successful for addicts. There is a lot of literature written in these 12-step programs, and also there has been many cases of people who have stayed clean and sober for many, many years. In the inpatient treatment centers, they suggest when an addict leaves to go to a 12-step program as soon as they get out. This is a continuous process that addicts could do outside of an inpatient or outpatient treatment, and it's been very, very successful. Addiction is a hard road to battle, but with hope there is faith, and with faith there is freedom from active addiction. No addict ever needs to die alone. And just remember, recovery equals freedom. Thank you.